Good governance in healthcare investigations involves ensuring impartiality, thoroughness of gathering evidence, protecting confidentiality and data privacy, and ensuring accountability for findings and actions taken. It also involves including stakeholders such as patients, their families, regulatory bodies, and others in ensuring that the investigation achieves the aims sought. Healthcare investigations can take many different forms. First, thinking about external investigations. Make sure you understand the process before engaging. For example, is it a voluntary or a mandatory process? Even if it's a voluntary process, this does still cause some issues for participation in relation to issues such as maintaining patient confidentiality and data privacy, and other issues along those lines. Familiarise yourself with the requirements and the procedures for the investigation. Designate a contact point for the external investigators. Think about gathering of documentation. In fact, this is a good governance point for healthcare investigations all the time in terms of thinking about how you manage documentation. Think about staff training. Do you need to give them some guidance on how to deal with inspections from external investigators? What about a policy for dealing with unannounced inspections? And how do you go about implementing the findings and corrective actions when you receive that report from the external investigation? These governance issues are replicated for the most part when designing internal investigations. It may be necessary to hold an internal investigation because you want to investigate a quality of care incident, a safety incident, or perhaps a fraud or abuse incident. Again, preparation is key. Think about the aims of the investigation and what you want to achieve. Have you set a scope and terms of reference for the investigation? Do your investigators know what they are being asked to do, and do they know how to go about doing it? Have you thought about issues such as protecting patient confidentiality and data privacy? This is even more important when you've asked an external investigator to come in and do the investigation for you. Again, have you involved the stakeholders in this investigation? Do they know that it is happening? Is there staff awareness about what's going to happen to records generated during the course of the investigation? And have you decided what's going to happen to the investigator's report when you receive it? Is it for your eyes only? This is very rarely the case in any body, and you may have to provide it to other organisations which are external to your organisation. Will this create any issues for the report that has been generated? These are just some of the important questions that you need to think about from a governance perspective when engaging with healthcare investigations. By thinking about these issues before you start on the investigation, whether it's external or internal, will lead ultimately to better findings from the report and ultimately better learnings and better outcomes for all in our healthcare system.